Hi, welcome to the Monash University Health and Physical Education Proposition Conversations. In this video, you'll be introduced to the key idea of health literacy and we'll provide you with in-practice examples.
Health literacy. What a contested term it really is, and I think the curriculum goes some way in, well, solving some of that contestation for us, but it also goes some way in confusing us even more. I think quite simplistically, health literacy is the way that we get and have health. I think it's also inherently the way we express our understandings of health, healthfulness, being healthy, being unhealthy, and these types of things. It's also the way in which we advocate our own health and the health of others. So I think beyond Don Nutbeam's amazing definitions and beyond the World Health Organization and health promotion, I think that health literacy is a whole lot to do with literacy itself. In that respect, health becomes kind of the context for developing any number of set of literacy skills. For example, literacy, like reading literacy, media literacy, advertising literacy, medical literacies, mathematical literacies. So what we're actually developing in young people are a set of skills associated with being or becoming someone who we might describe as health literate. Now, I think most certainly the three levels identified in the Australian curriculum help us to get there. They certainly help us to get a greater understanding of this. But I think health literacy and thinking about it beyond health promotion and beyond these definitions is going to be a key challenge for teachers, because what we need to do then is to bring those definitions to class as distinct activities.
So health literacy develops a range of knowledge, skills and understandings that help us to evaluate our life circumstances and the situations in which we find ourselves. It'll help us negotiate services and materials and information. And I think health literacy is importantly linked to general literacies, those literacies that support us in our everyday life. Like it's important to understand our learners, I think using health literacy approaches means we need to make topics that are relevant and meaningful to the people we're working with. So case studies lend themselves to exploring health literacy, working through vignettes, those sorts of things are quite neat approaches to unpacking a health literacy.
So health literacy is also about the various dimensions of health. You can be health literate in terms of your physical, emotional and social health, and I think these capabilities and potentialities link nicely to taking a strength-based approach. A health literate young person will be a young person who has a diverse set of skills and can make some complex decisions under pressure and can work to their own strengths and assets to do those things. I think that one of the things about taking a health literacy approach is that it requires us to be thinking about what young people might need into the future. And so I think it's really strongly linked to perhaps the potentialities that they have right now and some of the issues or life events that are going on for them right now, in order for them to be able to apply them contextually and to question them in terms of developing their health and literate skills in order to be able to apply them into the future. So I think a key for health literacy is actually making it fun and engaging. I think one of our challenges is going to be taking ourselves out of the dryness of the notions of what health literacy and health promotion are, and to bring to young people a diverse set of activities, ideas, case studies, vignettes and opportunities to explore the world of health literacy in a really affirming and engaging way. And that's most certainly, I think, will be one of the challenges of bringing health literacy to classrooms in Australia.
So we can extend notions of health literacy beyond just a focus on sort of drugs and alcohol or other mental health issues, etc. We can push it into the physical domain and the movement domain and think about how a young person who understands their body, their bodily functions, the way their bodily systems work, the way they respond to exercise and how they gain health benefits from movement, those kind of knowledges about movement can contribute to a health literacy. So if we can support young people to understand how movement and their bodies adapt and respond and change in positive ways, then we can start to provide them with tools they need to become healthy and negotiate their moving worlds.
My example for health literacy is actually so current, and it's something that, as adults we sometimes think that young people don't pay attention to, but certainly going on around us, there's a whole lot of information bombarding us around the health status of LGBTQI young people in Australia and their families around the plebiscite. So I'd like to leverage that opportunity in much the same way as I did with the AFL for women, and to think about mental health in the context of health literacy. So what I'd like to do in terms of doing an activity is, I already know that a whole lot of calls have been made to call centres. There's been something like a 20-25% increase in the number of calls made by young LGBTIQ kids to helplines looking for support around this really stressful time. So I'd like to actually use that kind of data. I'd like to perhaps potentially bring to class this opportunity for young people to even role model the types of phone conversations that they might be able to have with each other around any kind of issue that's causing them stress or heartache in their families or in their communities. I think what this one does is that it brings something that's really topical, and it actually brings it as an example to young people in terms of mental health and developing the strengths and the skills and the abilities. I mean, we know that data is suggesting that young people are actually accessing services, so it's a fantastic thing that we're actually getting these calls. It's terrible that we've got an increase, but it's a great thing for us to be able to leverage their ability to be able to make a decision to make a call. Can we apply this, therefore, to the rest of the young people in our classrooms? Well, most definitely, yes. And I think role-playing would be a way in which to do that. Unpacking the conversations that young people might have about what's worrying them, what's stressing them, and then taking them a little bit more broadly into the regular everyday lives around school, study, relationships, friends and family, beyond the LGBTIQ debate. Because most certainly all of us feel mental health issues on us at particular times, and I think it's really important to ground those things in the sorts of teachings that we can do in and around health literacy.
Thank you for tuning in to the Monash University Health and Physical Education Proposition Conversations. Bye.